get extravasation of fluid outside of the capillaries, capillary permeability. So this happens in sepsis, right? Sepsis is a chemical situation that causes leakage of fluid outside of the vascular system into the local tissues. And so you get fluid loss, person's dehydrated, drop in pressure. It's an inflammatory thing, so you get a systemic fever response. It's usually because of a pathogen or some other systemic chemical issue. And that's one of the reasons why the first treatment is lots of fluid, right? Start getting liters of fluid into this person to account for that. Leukocytes to the area, and then systemic fever, leukocytes, etc. that's going on there. So we have all of these things happening, and what we see outwardly as results of this process, so secondarily we see these things of heat, redness, tenderness, swelling, and pain. Remember we talked about in the last class or class before, we talked about cells, that we evaluate individuals based on like secondary and tertiary outward physical findings of blood pressure and pulse rate and all that stuff, but we're just seeing the results of what's already happening in them. Same thing's happening here. We're looking for the results of what's already underway, and what's underway is this inflammatory process. Okay, so vasoactive changes. We've got brief vasoconstriction, and then we've got the vessels opening up. Why are they opening up? Bring fluid to the area. What does that do? Just think about it. What happens if you have an injured elbow, right? You tore a ligament or something. What's the first thing that you would do as a first responder? Okay, but let's just say it was twisted, like a tennis elbow, or you twisted it mechanically or something, where you didn't have to patch a hole. It wasn't like an outward physical thing. Stabilize it, right? Okay, so stabilize it. And so what does that excess fluid in the area do? It starts to immobilize the area for one, just by the mere pressure and presence of fluid in the area. It also brings in all of the other components that we're going to talk about here. So this first process happening where you've initially got a little bit of vasoconstriction and vasodilation brings fluid in, which brings in nutrients, heat, brings in more blood to the area, brings in white blood cells, brings in chemical mediators, all those sorts of things, right? So that accounts for more blood means more redness. More blood means more heat, right? More blood and more tissue fluid moving into the tissue brings swelling, right? So we've got all these things going on here by just having more blood in the area. Heat, redness, swelling, tenderness and pain, and I'm going to add loss of function to this, right? Because tenderness and pain are really the same kind of thing. Why would you have tenderness and pain? You have a lot of extra fluid in this elbow, right? The thing's blowing up like a balloon. That's going to hurt. In addition to the fact that it's injured, right? That's going to cause pain in and of itself. But now you've got all this extra stuff in the area. That's going to hurt. That pressure, that internal pressure, is going to press on baroreceptors and pressor receptors, and that's going to cause increase in pain and tenderness. And then, if it's significant enough, you can have loss of function of the area. If it's bad enough, you can have the area immobilized where fluid can go in and pass but not out. What's that called? Compartment syndrome. Exactly. That's bad. We don't want that to happen. Okay. So these are some of the vasoactive changes. Increased capillary permeability, it lets all this fluid out. Proteins get out into the area, and then fluid follows them. We'll talk about that later. All right, so this is hyperemia. This is someone's eyeball. And so you can see they got something in their eye, and now you've got hyperemia occurring where one of the vessels is just engorged and it's bringing extra things out to the area to take care of whether it's an injury or a pathogen in that area. Could be both. All right, so it brings all this stuff. So we've got this transient response time frame, and this is like a 30 to 60 minute area here. and it's mediated by histamine. So what are histamines? Chemical substances that cause vasodilation, inflammation, right? And they're excreted by what kinds of cells? Mast cells. So mast cells will release histamine. Histamine causes inflammation. So when you're starting to get the flu or the cold and or you've got allergies and the roof of your mouth itches really terribly, right? And you start sort of scratching it with the back of your tongue, you're breaking mast cells, which releases histamine, which causes more inflammation, which causes more itchiness, which causes you to scratch it more. Get into this terrible vicious cycle. And it's terrible, right? I get it. It feels great to scratch it, but then it gets worse after that. So we get this histamine response. In a delayed response here, this could be up to 8 hours. We'll talk about this a whole lot. We have the complement system, bradykinin, dead neutrophils, all this stuff as mediators to this delayed response. So this could go on for some amount of time unless it's mediated. And so you want to ensure that it's mediated. And then we get this prolonged 24-hour time if we have necrosis and other things going on in the area, right? And so we've got a transient response, this delayed response, and then a full sort of whole immediate response of the whole thing. These should look familiar. Everybody doesn't know what these are. We'll talk later. And this. All right, so lymph. So we know what the vascular system does, and we talked briefly about the lymphatic system. What does that do? It's up here in case you remember. It drains off the excess, right? And so normally, lymphatic system works great unless it's not. And so in cases where someone has lymphedema or blocked lymphatic system in some way, shape, or form, or removed or collapsed lymphatic system, it will take the extra fluid away from an area, which is great, except in inflammation. So in an inflammatory response, fibrin will clog up the lymphatic system so that it doesn't take fluid away. Why is that happening from what we know so far?
Because you need the fluid for the inflammatory response.
Because you need the fluid in the area for the inflammatory response to occur and continue, right? So this extra fluid immobilizing the area, allowing the lymphocytes to take care of an invading pathogen, clean up dead debris, etc., as part of that regeneration response. So they'll initially be blocked up, and then once things start resolving, they will unblock. The fibrin will be moved out by plasminogen, and taken off, and then the fluid gets removed out of the system. So that's the function of the lymph channels initially, and then as a follow-up. Talked about mast cells and their degranulation. So their degranulation by either a pathogen or some kind of trauma response, including arrow twitching, will cause the release of histamine, interleukins, prostaglandins, cytokines, and chemokines. And all these things are ways of the body to track and neutralize invading pathogens and or clean up debris and dead or dying cells or cells that have been ripped apart or anything like that, to clean up the area to make it better for regeneration. All right, so leukocytes are some of the first pieces of this from a cellular response, white blood cells, and they do three different things. So there's emigration, which is movement across the vascular system into the area where the tissue damage has occurred. And so that's one piece that they do. They margin that movement and roll out. And then there's chemotaxis, which brings them specifically to the site of injury and or the pathogen. So remember we talked about cells communicating with each other by ligands, and there's autocrine and paracrine signaling. So other pathogens do this as well. And when they excrete their little, hey, I've been here notes throughout the system when they're traveling around, those are like breadcrumbs for white blood cells. And you're like, oh, something's not right about this. I'm going to follow these tracks to its origin to hopefully destroy that particular pathogen. So that's chemotaxis, bringing them to that particular area. Phagocytosis then is the ingestion of those materials, and we'll talk a little bit more about that when we get into the immune response and how some of that occurs with those as well. Questions on this so far? Everyone's good? Okay. So you should know what these things do, specifically histamine, prostaglandins, leukotrienes, cytokines, all those you should understand what those are and what they do. So prostaglandins bring vasodilation. Vasodilation brings pain. They also can produce a fever. Why is fever important in this? Well, that's what fever is. Why is that important? Speak loud so everyone can hear.
Changes homeostasis, so whatever foreign object, bacterial, viral, debris, doesn't survive.
Yeah, so you're changing the environment to make it inhospitable to the pathogen. Right? So that's part of what fever does. Leukotrienes, vaso and bronchoconstriction, platelet activating factors, leukocytes cause bronchoconstriction, nitric oxide, vasodilation, and cytotoxicity, and then cytokines, we've got leukocyte activation and fever also. So understand a bit of what these things do and when they're out there, what happens, and the results. And what are we going to see? We're going to see the end result of these things. We're going to see the fever, right? We're going to see the redness. We're going to see the bronchoconstriction. We're going to see the drop in blood pressure because of vasodilation, depending on how big the event is. I mean, you're not going to see so much vasodilation to cause a drop in blood pressure with someone with a paper cut, unless they just really can't handle paper cuts. But you may see it in some other cases. All right. And one of those cases is sepsis. Exactly. Perfect. Leukocytes, they stimulate leukocytes. So we'll talk about that a little bit as well. Cytokines, these are really messengers. And so you'll see cytokines out in the system, and they'll cause a variety of effects, which we saw earlier. Interleukins are a type of cytokine. We'll talk about IL-6 especially, and when we talk about the immune system as a communications network, and interferon as well. So cytokines are some messengers that way. All right, so here's just plain activation and emigration. And you'll probably see this chart on an upcoming breaks. I'm only kidding. I'm not going to. That's ridiculous. What I want you to know is that certain chemicals or situations are going to cause leukocytes to activate within the vascular system, which will cause them, by this complex process here, to attach to the vascular wall, marginate and diapedese through. And what's happening at that particular location also is the vascular system is going to become more permeable to allow some of that margination to occur as well. Okay, make sense? So this is happening in the presence of physical criteria and chemical criteria that we talked about previously. So that I want you to understand. But this is what it looks like. Here's chemotaxis, right? And so here's a bacteria that's emitting different kinds of chemical transmitters. And a neutrophil comes along through the bloodstream, diapedesis through, and then targets that bacteria by following those particular signals to that bacteria. Here's another chemotaxis. I don't know what the heck I was looking for, and I came across this. I'm like, putting that into my conference slides. All right, so leukocytes. And we'll talk a little bit more about what happens in a specific response in the immune system, but what happens here with leukocytes from a cellular response is that you've got 3 different kinds that activate at different stages. And so in an early stage, you're going to have your granulocytes, your basophils, your neutrophils, and your eosinophils, and they're going to come in huge numbers. They'll diaphyses, they'll chemotaxis to whatever pathogen it is. They'll try and destroy it in a variety of different ways. And some of them will do a great job, and some of them will not. And so your basophils release histamines, eosinophils will give you an allergic kind of response, and your neutrophils will engage in phagocytosis. So all these things are going to happen at the same time. This is your immediate response. If these guys, these granulocytes, can't take care of the situation immediately, then, and it's an ongoing process, then we move on to monocytes. Now, what's happening when granulocytes are getting there in terms of a systemic response? Body's got to ramp up some production of granulocytes, right? And it's got to move these granulocytes to that area. And again, depending on how big of a response you need in the system, that's going to cause the requirement of energy, which means you're going to have an increased metabolism, which means you're going to have general overall increased temperature, right? Yes? Okay. So that's going to happen. So you'll have glucose needs as well in some of this response, depending on the size of it. Certainly not for the paper cup, but for other ones, you could have a little bit more of a reaction. Monocytes, 3 to 4 days.
Why do you typically see people that have an infection have higher blood glucose levels? Because you're trying to get that glucose in the system for all this to happen?
Initially, yeah, that's going to happen because your liver is going to dump, what it can into the system and make available things that you have to an extent. If you don't start ingesting nutrients to create glucose, right, to provide glucose to the system, then it'll eventually slow down quite a bit. And that'll happen anytime you need an energy load into the system, right? But this is one of the times where you need an energy load. So, all right, so after a little while, if that doesn't work, monocytes start coming in, and they're kind of a lot bigger. They're huge comparatively, and they're just like, all right. So these are like the tanks that are coming in, right? The granulocytes are kind of like infantry kind of personnel. These are like, all right, time to bring in the bigger guns. So let's bring in the monocytes. And then after that, we have lymphocytes that come in 7 to 10 days later. And those will include T and B lymphocytes, and that's also for a very specific kind of response of the immune system as a component of this. And so granulocytes, monocytes, and then lymphocytes. All right, talked about these and what they do. Talked about these. These are absolutely much bigger. They're far more effective, but you don't need them for everything right away, so they'll only come in when they're needed. And then our lymphocytes, and we'll talk about that with antigens, antibodies, and such when we get to that particular lecture. Okay, another example of a cell of a neutrophil being chemically activated, diapodecing by margination, following through chemotaxis to bacteria, and then engulfing them through the process of phagocytosis. It's a lot easier picture than that. So you can also see over here, the bacteria are causing the release of their substances, their cytokines and such, causing damage to cells here, and also signaling for neutrophils to activate. And then when neutrophils do activate, they'll also release cytokines, and they'll cause prostaglandins and leukotrienes to come to the area as well. All right, so here's our granulocytes and monocytes, and this is innate immunity component to all of this, of what they're going to do and how they're going to do it. And then when we get to an adaptive immunity, that's that very highly specific stuff we'll talk about later on in the immune system. But innate immunity is the stereotypic inflammatory response, and then adaptive is a little bit different. But this is sort of generally what's occurring in these different sections here. So I put in some things for you all to watch. Are you able to click on these and follow them? If not, then I'll pull this out and send them to you separately. But in each of these systems, these are just sort of great ways of looking at it. The coagulation system, the complement system, and the kinase system. We'll talk about these, use some other methods to look at this stuff as well. Okay, so the coagulation cascade. Do we need to take a break first before we get into this piece of it? Let's do that. Let's take 7 minutes or so.